Hi, and welcome to Commonwealth Orthopedics. In today's episode, we are going to be discussing when it's time to have a total knee or total hip replacement. What are the most common signs and symptoms that you find that it's time for a replacement for a patient?
Well, the biggest thing that people talk about is pain. That's the number one thing. People can have where the knee gives out or the hip gives out, but mostly it's just pain that the knee hurts.
Okay. And how do you differentiate between normal aging pain and bone-on-bone pain?
Well, that's a good question. There's really not normal aging pain. People have pain, and it's really not normal at any age. So anytime you have discomfort in your knee or your hip, that's something that should be checked out. If it happens suddenly, and arthritis is a weird thing. Sometimes you can have arthritis for many, many years, and it really doesn't bother you. Then all of a sudden you have a lot of pain. So anytime you have anything consistent that lasts for a day or two or severe, you should really be checked out.
Okay. And are there any specific risk factors that would accelerate a patient to have a knee or hip replacement?
That's a good question. I think one of the things that is pretty common to a lot of patients is that they've injured their joint in the past. That happens a lot nowadays. People are much more athletic than what they used to be, and they're doing sports and things at younger ages, and we're living longer. So an injury, it does catch up to you. And a lot of times the thing that you did in your 20s, before you know it, you're in your 50s and have some pain. So again, just because you're getting checked out doesn't mean that you would need surgery, but things can be done to alleviate the discomfort. And other times you really don't need anything to have happened. You might have had something happen that was just minor and you didn't even notice it and can catch up with you. And we still don't understand arthritis completely, so people's knees and hips do wear out just out of the blue. It does run in families, and it's not necessarily genetic, so any discomfort that you have, it deserves to be checked out. At least an x-ray won't hurt anything.
And how do you determine if a patient is a good surgical candidate?
Well, there's a lot of factors for surgery. First of all, to have the criteria to meet to get an operation is the first thing. People's knees and hips, they can bother them, but the thing is, or x-rays, to make sure that your x-rays and your physical findings do show that you do have arthritis in your knee. Some people have pain and they really aren't a point where their joint is worn out enough. So that's the first thing to do, is to see that you have the criteria for needing a joint replacement. And that's what the doctor's job is to do. That's what my job is. You come in, determine it, I look at it and determine that it is coming from the joint you think it is. And that does bring up a point where people say, well, my knee hurts. But sometimes it's not your knee, it's from someplace else. And that's where I come in for you. Once you've determined that your joint is bad, the thing I look for nowadays, as opposed to before, is a limitation of what your activities can be. Right now, we're not waiting for you to be bedridden and have pain at night and excruciating pain. That's not a criteria. You don't have to wait that long anymore. These replacements work so well that we're really just trying to get you at a point where it's starting to diminish your activity level. And when that happens, that's when we want to start thinking about something, because getting inactive as you get older is not really very healthy for you. And that's the idea of everything that we're doing here with our practice and with the Weight Loss and Wellness Center. It's to try to keep you active and healthy, because activity is a key to health.
Yeah.
Now, once that's all said and done, is medically to make sure that you're healthy enough to actually have the surgery. Once we've established that, yes, you do have a bad joint and you need some treatment, and it could be surgery, but we need to make sure you're healthy enough. And that's what's involved with getting screened by your family doctor, and for me to talk to you a little bit to make sure your health is, that your diabetes, if you're diabetic, is under control, and that your blood pressure and you have heart issues and things like that is very, very important. Other thing as well is one thing that we're doing here is weight, is trying to make sure your weight is down into a level that is going to be safe for surgery. Correct. I mean, there are ideas to try to optimize you for the operation, to make sure you go through the operation and go, well, I don't know what the big deal was. I got my knee and I was fine. Well, that's what I'm looking for. I'm not looking for rolling the dice and taking a gamble. There are times we do have to do that sometimes, but initially we really want to try to optimize you in every way to get you a good, healthy recovery and forget about your joint that we just replaced.
Wonderful. And what can they expect as far as recovery if they would decide to have surgery, have their replacement? What time frame would they look at for surgery? Because I hear patients ask that a lot, how long until I'm going about my regular duties?
Right.
And I hear you say a lot that it's a gradual thing.
Well, what happens is people say, when am I going to be back to normal after my surgery?
Yeah.
And my question is, what's your definition of normal? Because it's relatively speaking, because first of all, hip and a knee replacement are not an operation that you do the surgery, you're in bed for 6 weeks, you wake up and you're normal. It's a gradual process. The first thing to expect is that when you go to the hospital, the surgery takes about 30 minutes to do or so, a hip or knee replacement. There's either way a little bit, but about 30 minutes. You spend overnight in the Surgical Institute of Reading, then you go home the next day. First day is resting, and you're actually up and walking the first evening after surgery. So if your definition of being back to normal is walking, well, I guess that's one day. Then after that, you're on a walker. I keep my patients on the walker for a week just to make sure that you're safe. You get through recovery, you're going to physical therapy. And the milestone that I look for about 3 weeks or so, most patients are coming in walking on a cane at that point. So that's when they tell me they kind of feel like they're getting back to normal. So, and by 6 weeks, most people say, well, I kind of feel like I'm getting back to normal. I'm doing normal activities, hitting a bucket of golf balls, going in the garden, going for a walk, those sorts of things. And really 80% of your healing probably happens in the first 6 weeks, but that 20%, that takes a whole year. So if you want to be back to as good as you're going to be after hip or knee replacement, you got to wait a year to a year and a half. But that doesn't mean you're not doing well and doing fine and feeling 1,000% better. So that's very, very important concept. And the other thing is the humans have an infinite variety of how quickly we recover. I mean, you know, sometimes you get a cold that lasts you for a day. Sometimes you get a cold that lasts for a month. So again, I always wish I could tell people how they're going to do, but I really have no way of knowing. Some people come 3 weeks, it's like they never had an operation. And some people at 6 weeks are having a little more struggle. More often than not, it's really the recovery that I basically told you. So hip replacements, it is true, are easier to recover from than a knee replacement. Because with your hip, we're sitting here, our hips are bent. A knee replacement, you have to bend your knee because you can walk with a stiff leg, but you really have trouble doing your activities with a stiff hip. So the knees will generally recover a little bit slower, but in the end, it's worth it.
Yeah. And with the Mako replacements that you do, are there any restrictions with the Mako, or can they pretty much go about their lives?
Yeah, the Mako is a robotic way to actually do the surgery. So it really has revolutionized how we do the operation. The operation used to be done manually with trial and error, but with the robotic surgery, really most of the surgery is done on the computer through 3D analysis of their bones during the surgery in real time, so we can do as little to you as possible. A lot of the planning, we do the surgery, get the sensors on. I do a lot of calculations on the computer, and then once we got it, we just do it and can get you through the operation. That's why it happens so quickly. So the Mako will allow you to have a much more natural feeling knee. This isn't in the literature yet. I mean, it's not that. It's a very subjective thing to tell people how the Mako is different. All that I know is that when I see people back in a year and I examine their knee, the knee seems normal. Whereas before doing it manually, as good a surgeon as we all are, sometimes it just didn't feel quite like a normal knee, but now it's a very consistent result, so it's your best chance to do it. And also with the hips a little different operation. The hip, we're able to put your hip bones back in exact relationship to the rest of your bones, so your muscles know exactly where your hip is. So I personally didn't think in the beginning that would make much of a difference during the Mako hips, but after I did it, it's like, well, of course this makes a difference, because you can put it back exactly where the patient wants. That's always better. So again, the Mako doesn't take any longer, and it actually minimizes your surgical time and minimizes what we actually do to you during the operation. And that's a big thing. People say, well, I want to get it better as quick as possible. This operation is everything as little as we can possibly do and still do the surgery. It is a big operation, that is for sure. We don't minimize it, but the thing is, the Mako has really made it, it's a scientific procedure as opposed to a little bit of an art project. That's what I said. Before I had to use my eye and look at it, but now we can measure it and do it and get it done quickly and get you back on the road to recovery.
That's awesome. Very informative. Yeah. So if you're on the fence or you think you might need a hip or knee replacement, just give us a call here at the office and we'd be happy to schedule an appointment for you.